guys, it's Gianna Midwifay. Today, for my third installment in my labor induction series, I wanted to talk about being induced for advanced maternal age. What does that mean? What is this title that unfortunately many people are getting slapped on their charts? Advanced maternal age, elderly, prima gravida. What does that look like? What are the risks associated? And why do we recommend induction for it? Let's get into it. Always, I want to encourage you, please like this video, subscribe to the channel. It really helps me know which videos you guys like and what other content you want. So please go ahead and like and subscribe if you haven't already. Alright, so what is advanced maternal age? Advanced maternal age is when a birthing person is 35 years or older at the time of their estimated due date. So not the time you conceive or when you harvest eggs or anything like that. It is the age that you are when you give birth. Are you 35 or older? You're probably wondering, how was this random age selected? And the history of it is actually in the 1970s, 35 years old was the age at which your chance of having a genetic abnormality in your embryo equaled your chance of having of losing a pregnancy from the amniocentesis test. So in the 70s, when physicians were recommending an amniocentesis, which is the test where they place a needle in the belly to take genetic material from around baby to test the accuracy of genetic abnormalities, that procedure, the risk of miscarriage from that procedure equaled the risk of having a baby that was chromosomally abnormal at that time in the 70s. Okay, so that's where that age came from. That's a very interesting definition because now, with the advancement in technologies and procedures that we have, the risk of amniocentesis causing miscarriage is much, much, much lower. And there's a lot of other genetic tests that we can do that may not even require amniocentesis. So to still have 35 years old as this arbitrary age that shows that all of a sudden this obstetric risk goes up is interesting. That still plays a part today. With that background, it's important to note all of a sudden your risk doesn't just go up at 35 for things, right? As for all health and medical conditions, age is a risk factor that compounds over time. So again, it's not that all of a sudden at 30, at 35, at 40, risk for different things, including maternal conditions, is significantly increased on your birthday. Okay, so that's one point to keep in the back of your head. So with that definition, let's talk a little bit about the increased incidence of this. It's really interesting in this millennial generation. You know, we are a generation that is putting off parenthood longer than previous generations, and for a lot of good reasons, for advancement in career for women and birthing people, for better birth control methods and technologies to allow you to take control of your fertility, right? So for a lot of good reason, that's happening. Furthermore, there's the side of assistive reproductive technology where people that are older and deciding to have kids, or, you know, coming into partnerships and deciding to have kids later in life, now our assistive reproductive technology is getting better and better, that we are able to help people achieve pregnancy at a later age. So that is important to note, that there is just an increasing incidence of this advanced maternal age status as opposed to in the 1970s, 80s, 90s. Here's a chart that kind of talks about the incidence of women giving birth at later ages now. Essentially, in a high-income country like the US, 20% of all births are to people that are 35 years or older, and 10% of all first-time birthers are 35 or older. So it's just an interesting statistic that I wanted to share. So what are the risks of being advanced maternal age, of being over 35 at the time you're pregnant and giving birth? Let's look at it twofold. Let's specifically look firstly at medical issues. Again, like I said, and I think a lot of people know, medical issues increase with age. Chronic stress on our blood vessels, on the thickening therein, blood sugar regulation. So this all happens in general. as we get older, okay? So risks of higher blood pressure, risks of diabetes, that just increases with age in and out of pregnancy. Now, obviously, there's a lot of other lifestyle risk factors attached with that, as well as genetic risk factors attached with that, right? So it's not just your age. Are you a 37-year-old vegan runner? Or are you a 37-year-old who comes from a family of all diabetics and people with high blood pressure that works a high-stress job, right? And obviously there's a lot of intermix and interplay therein. So yes, as we get older, we have increased risk of medical conditions in general, but there's a lot of lifestyle and modifying factors that we can put into play there. When we look at pregnancy-specific risks, it's important to kind of divide this up even further. Most of the risk of being older when you're pregnant is truly with genetic abnormalities and fertility. Here's a chart talking about how fertility declines with age, and the quality of the egg specifically declines with age. Unfortunately, the same doesn't happen for our male sperm carrying counterparts, but for the quality of the egg, it significantly starts to decrease truly at 35, but really at that 37 and that 40-year mark. To put it in a different way, at the age of 30, a healthy egg carrier has a 20% chance of getting pregnant. At the age of 40, that's gone down to about 5% a chance of getting pregnant. So that just speaks to your egg reserve, the quality of your egg. That quality of the egg contributes to genetic abnormalities. You're at an increased risk of genetic abnormalities such as Down syndrome, other trisomies, and things that may or may not be compatible with life. Those things may result in a pregnancy ending, a miscarriage, or in you choosing to end a pregnancy because of genetic abnormalities. So I think that's really important to point out the fertility risks, achieving pregnancy, maintaining pregnancy. That's one area of pregnancy-specific risk for women at 35 years or older. And now, say, we're past that, we're moving into the third trimester, everything is looking fine and well. What are specific risks to you for being 35 or older? There's data that looks at maternal morbidity and mortality, looking at severe hemorrhage, ICU admission, all of this. I'll have that in a chart here. So this is the increased risk that facing people 35 years and older. And then there's an increased risk of C-section as well that is included in this chart facing people 35 years and older. When I was doing these research and looking at these risk factors, it's kind of hard to pinpoint what comes first, right? If just your age, 35 and older, is the reason why this cascade of hemorrhage, ICU admission, etc. happens, versus if it's just a more active management of a pregnancy of a person at this age. Providers being more cautious and more likely to intervene quickly when someone is in this age group. Obviously, the huge biggest risk that many people are concerned with and want to mitigate whenever we're recommending induction or delivery timing is the risk of stillbirth, a horrible, horrible, devastating outcome for a whole family. Again, I always like to point out that risk of stillbirth is so relatively low. It's always important to know your relative risk versus your absolute risk of stillbirth. The overall rate of stillbirth after 37 weeks in an 18 to 34-year-old population was 1.7 per 1,000. Between the ages of 35 years and 39 years, the rate is 2.2 per 1,000, and in the age group of 40 and older, that rate is 3 per 1,000. So although it does increase with your age, and that is significant, it's still such a relatively low absolute risk that stillbirth alone should not be the reason why you are considering induction because of your age. So now that you have all this information, you can go into a conversation with your OP provider with this knowledge of what your increased risk actually is because of your age. If you have no other health complications, no other obstetric complications, if just your age of 37 years old is what's looking you down the face, what would you do to move forward? So we always have the options of expectant management versus active management. Expected management is that watch and wait approach. What would you reasonably expect to happen if we did nothing? This involves usually the increased surveillance, increased appointments, the non-stress test, looking at baby's heart rate, the amniotic fluid index, checking on the fluid around the baby. These are all things that can give us signs of maternal and fetal well-being that allow us to proceed and say that as of right now, all looks well. In 2012, the Society of Maternal and Fetal Medicine published an opinion saying that fetal surveillance, so doing NSTs and AFIs on a regular basis solely on the basis of advanced maternal age, isn't necessarily a reason. It says there's insufficient evidence to show that fetal testing for advanced maternal age can reduce the risk of stillbirth, right? And this is where it gets hard in counseling and discussing recommendations with families. I can never assure you of what an outcome is going to be. All I can do is provide you with accurate data and truly inform you so you can make the best decision for yourself. Some other good data that was published in 2013, the Royal College of Obstetrics and Gynecology put out a very powerful opinion statement that basically recommended induction at 39 weeks for birthing people that are 40 years and older, because they found that their rate of stillbirth at 39 weeks was about equal to the rate of stillbirth at 41 weeks for patients in like the 18 to 30-year-old range. So that's something to consider. As always, go through what are the risks, what are the benefits, what are the alternatives, going through this discussion with your partner, with your provider, knowing what your options for induction are available to you, knowing what options for increased surveillance as you near the end of your pregnancy or go past your due date, knowing what those options are to you so you can truly make an informed decision. I hope this video helped. Please like, comment, subscribe, share this video with another mama, another family, another elderly family, if you will, so that they can share in the knowledge as well. All right, I'll see you next time. Take care. Bye-bye.